Hello, I am Pharmacist. Today we discuss about pharmacology, uses, side effects, contraindications, pregnancy warnings, drug interactions, and dose of carbonicillin anticarcillin. Pharmacology. Carbonicillin anticarcillin are beta-lactam carboxypenicillins antibiotics that belong to the extended-spectrum penicillins. They work by inhibiting bacterial cell wall synthesis, which ultimately leads to bacterial cell death. Both drugs bind to penicillin-binding proteins, which are enzymes involved in the formation of bacterial cell walls, resulting in the disruption of bacterial cell walls. Carbonicillin anticarcillin have a broader spectrum of activity than penicillin G, with greater activity against some gram-negative bacteria. Uses. Carbonicillin anticarcillin are used to treat a variety of bacterial infections, including respiratory tract infections, urinary tract infections, skin and soft tissue infections, and gastrointestinal infections. They are also used to treat infections caused by susceptible strains of Pseudomonas aeruginosa. Both drugs are sometimes used in combination with beta-lactamase inhibitors to increase their activity against resistant bacteria. Side effects. The most common side effects of carbonicillin anticarcillin include diarrhea, nausea, vomiting, and allergic reactions. Other side effects may include liver toxicity, kidney damage, and anemia. Carbonicillin has been associated with an increased risk of bleeding, while ticarcillin has been associated with an increased risk of thrombocytopenia. Contraindications. Carbonicillin anticarcillin should not be used in patients with a known hypersensitivity to penicillin or any other beta-lactam antibiotics. They should also not be used in patients with a history of cholestatic jaundice or hepatic dysfunction associated with the use of carbonicillin or ticarcillin. Pregnancy warnings. Carbonicillin anticarcillin are generally considered safe to use during pregnancy. They are classified as pregnancy category B drugs, which means that animal reproduction studies have failed to demonstrate a risk to the fetus, but there are no adequate and well-controlled studies in pregnant women. However, as with all medications, their use during pregnancy should be carefully considered and monitored by a healthcare professional. Warnings. Carbonicillin anticarcillin should be used with caution in patients with a history of allergic reactions to penicillin or other beta-lactam antibiotics. They may also interact with other medications, so patients should inform their healthcare provider of any other medications they are taking. Carbonicillin has been associated with an increased risk of bleeding, while ticarcillin has been associated with an increased risk of thrombocytopenia. Both drugs can cause a superinfection with non-susceptible organisms or yeast. Drug interactions. Carbonicillin anticarcillin may interact with other medications, such as warfarin, which can increase the risk of bleeding, and oral contraceptives, which can decrease their effectiveness. They can also interact with other antibiotics, such as aminoglycosides, which can increase the risk of renal toxicity. Dose. The recommended dose of carbonicillin anticarcillin will depend on the type and severity of the infection being treated. They are usually administered intravenously, and the dose may need to be adjusted in patients with renal impairment or hepatic dysfunction. The usual adult dose of carbonicillin for respiratory and urinary tract infections is 1 to 2 grams administered every 6 hours. The usual adult dose of ticarcillin for respiratory and urinary tract infections is 3 grams administered every 4 hours. However, dosages may vary depending on the infection and individual patient factor. Thank you.